Time to call our meeting to order, and I'd certainly like to thank each one of you for being here. I don't see anyone with the press, so gonna ask you if you have your cell phones, if you would silence them or whatever to keep them from ringing. But if they do, if you would just step out in the hall, answer, then you can come back in. And having said that, I would like to now ask you to stand, and I will read some invocation. Father, we thank you for allowing us to meet this evening, and we pray for wisdom, and we can make the right decisions for all the citizens of Bullock County. And especially tonight, we want to lift up the Lee Hill family. What a friend he was to a lot of people. And we just thank you for letting him have us to have him for those many years, and the impression that he made. Continue to lift up this county. We just pray your blessings on it. I ask all this in Jesus' name. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'll now ask for the roll to be called on Ms. Gaines, please.
I, Olympia Gaines, President and Clerk of the Board of Commissioners of Bullock County, hereby call the roll for those on the governing body. All those present shall answer by saying aye. Chairman Ward Thompson.
Aye.
Vice Chairman Anthony Simmons.
Aye.
Commissioner Ray Mosley.
Aye.
Commissioner Jackie Stringer.
Aye.
Commissioner Kurt Deal.
Aye. Commissioner
Timmy Rushing.
Aye.
Commissioner Walter Gibson.
Aye.
I have determined that we have all members of the Board of Commissioners present, therefore we have a quorum to conduct business for the good of the citizens of Bullock County. I now yield the floor to the chair.
Ms. Gaines. Next is our zoning agenda, and we need a motion to approve the zoning agenda. Motion. Second. Any more discussion? All those in favor, show of hands. Unanimous approval. Mr. Newman, I believe you have one item tonight.
Yes, sir, I have one item tonight. Ms. Betty J. Palmer submitted an application for conditional use for a personal care home. The property consists of 5 acres and located at 550 Holloway Lane. P&Z made a recommendation to approve the request with conditions by unanimous vote. And Ms. Palmer did have a conditional use approved by this board about 5 years ago, but she never did go through with the home at that time, so she's back now because it had lapsed. This is the property. You can see it's kind of way out and out off of it's way out the other side of the register. I'm trying to say. This is her property. You can see her home up in the top, and this is the sign located on the property. This is the driveway to her home, and this is her home, and this is kind of an overview of her property. Ms. Palmer is here tonight, and I would like to ask her to come forward. Yes.
And if you'll state your name and address for the record, please.
That's Betty Palmer, physical 550 Holloway Lane, registered Georgia. As he said, I was attempting to do this a couple of years ago, but I had some sickness in the family, and so I would like to open a group home for young teens at this time. And I would greatly appreciate if you all would allow me that opportunity to be able to be of a service.
Mr. Chairman, no one signed up to speak, and the 5 conditions were the ones that were originally placed on it when it was approved before.
Now, do we have any discussion or questions from the commission? Comments?
Mr. Chairman, I make a motion to approve. How many children you plan to have in this facility?
To start off with, I'm gonna go with 3, but probably no more than 7 or 8.
Thank you. We have a motion on the floor. Do we have a second to that motion?
With conditions.
With conditions?
With conditions.
Okay. We have a motion. with conditions and a second. Any more discussion? All those in favor of the motion, show of hands. Unanimous approval. Thank you for coming.
And thank you all.
Good luck.
Thank you.
Mr. Chairman, that's all I have tonight.
All right, thank you very much. Before I entertain a motion to approve the general agenda, do we have any changes that need to be made by the assistant county manager or the commission board?
No, sir.
All right, then I need a motion to approve the general agenda.
I move we approve the general agenda, there's no addition or correction. Second.
Have a motion, second, any more discussion? Hearing none, all those in favor, show of hands. Unanimous approval, thank you. We now have a presentation, and seeing that, we'll make presentations, the employee COVID-19 task force.
Thank you. Good evening. I'm Cindy Allen, I'm the HR director, as you all know, and want to just give you a brief update on COVID-19, the impact in the workplace, and some of what the county's doing, mostly internally to try to combat it or address it the best we can. You know, we've all seen the news, and we continue to see the news, and we're seeing how the cases are growing in the community and in the county and in the state. You know, our employee workforce is just a microcosm of that group, and so we're certainly seeing the same thing within our workforce. In HR, we're trying to do several things. One is to monitor the impact on the workforce, to make sure that we're following protocols so that our employees are out of the office when they need to be out of the office, but also to make sure that they get information and benefits that they're entitled to under federal law. So it's been a busy time in HR. I wanted to share a few numbers with you. March, April, and May, the earlier months of the pandemic, were fairly slow for us in terms of our workforce. We saw a great uptick in June. We started to be very busy in June in terms of the number of employees that were being affected in one way or another. And then July, even a bigger jump. So July, we spoke to many employees that have had an impact personally. Roughly 10% of our employee workforce at this point, if you look at pure numbers, has had a scare of some type, either an illness that was or they thought could have been COVID-19, or they were exposed or believed they were exposed. So to date, we've had 18 COVID positive employees that we've worked with in HR to try to make sure that we support them and provide them information that they need. Those employees are across a variety of departments, so they're not all located within one department. So far, there's not been any evidence of any employee-to-employee transmission or employee-to-citizen transmission. I'm certainly not a doctor and can't say that definitively, but I have no reason to believe there has been any. But we have really been hit, what I believe has been hit hard. Some departments have had a harder time than others, continuing operations. Depending on whether an employee is ill or whether they've been exposed, they have to, in accordance with CDC guidelines, remain out of the workplace for 10 to 14 days minimum. And so having that disruption is difficult. It's difficult for employees and it's difficult for departments. We do expect those disruptions to continue for the foreseeable future. I don't see any indication that it will slow down anytime soon. I certainly hope it will. Also, the individual impacts of this situation vary depending on things like family dynamics, whether there are child care concerns within the home, whether an employee can work from home at all or not, what kind of job they do, what size department they're in. So all of those things play a role as well. And what we're realizing is that there are no bubbles. Home and work are not separate bubbles, but the things that we do and the decisions and actions we take at home impact work and vice versa. So, you know, we want to encourage all of our employees, everyone in this room and employees in general to continue to try to avoid large groups, stay socially distanced. As we can see from this room, and we have people in the hallway tonight, that it's not always easy to maintain 6 feet of distance. So that's what we're asking our departments and employees to do. A couple of weeks ago, Mr. Couch developed and distributed a survey to send out to employees, asking them for their thoughts on the county's handling of the pandemic and kind of where we were. We had about 300 responses, which is really good. And questions ranged on everything from communications, leadership's handling and decisions, safety precautions that are in place, disinfection practices. So it's a pretty broad survey, along with the fears that employees have about transmission at home or at work. Roughly 3/4 of the employees who responded said that they were happy with what the county has done and is doing. We had about 10 to 15% that expressed some opportunities for improvement, and then those in the middle didn't express an opinion either way. So in learning from some of those opportunities for improvement, we've developed some exposure guidelines. So recommendations for what happens after an illness or exposure. Those have been distributed to department heads and supervisors, so that HR is not hoarding the information about the questions that we'll ask and how long an employee might need to stay out of work. So those have been distributed. And we've also developed a standard protocol or standard template to communicate with employees about a positive within their work group. Of course, protecting the privacy of the ill individual, but making sure that employees are aware, just so they can monitor their symptoms. So that's been done. And in addition, and I think all of you know this or knew this already, but Mr. Couch has put together a task force of individuals, primarily from the Recreation Department, to look at kind of across the spectrum of what's happening in the county with regard to COVID, what our response has been, what our operational challenges are, what are the unique situations in our various buildings and departments that make it more challenging. So they've been working on this for a few weeks now, and several members of the task force, some of the leaders of the task force are here tonight. Wanted to give you an update. I'm going to ask Kimberly Sharp to come up. I think she's going to be the spokesperson for the group. And after she's completed her comments to you all, I'll be happy, and I'm sure she will too, to answer any questions you have. Thank you.
Okay, sure. You can just talk to them.
Good evening. I'm Kimberly Sharp, for those of y'all who do not know me. I am the program supervisor with the Recreation Department. First off, I want to thank y'all for the privilege to serve on this task force. It's been very interesting, learning a lot of things. I'm going to be responsible for completing the training portion of the reintegration plan to all department heads, and then to any employees in which the department heads choose for us to train if they do not want to do so themselves. The training will be a recorded PowerPoint with a voiceover. It will allow the training to be presented during a live Zoom meeting where questions can be discussed and answered at that time. We'll also make it available via a web link that will allow all current employees, as well as any new hires that were to come on board, to be able to receive the same accurate information. The training will cover our full reintegration plan, which Adrian's going to go over a little bit. So we will want to ensure that all departments are as universal as possible in the information they are giving to the public as well as to their employees. The training will discuss prevention and response, as well as social distancing and protection from the public, as well as our employees. Our sanitation and cleaning will be covered, as well as the communication aspect among employees, which Cindy mentioned slightly with our letter, the template that she has come up with. We'll also include in the training the scenario worksheet that Cindy has developed in order to help all the supervisors best understand how they should approach each situation without having to call HR at every scenario needed. And also, as the situation is ever changing, we'll be able to continue to update that training and information
for employees as we need to. And Adrian and Cosby is going to speak also on the 4 elements of our reintegration plan.
Good evening. I want to thank you also. I know Mr. Cox going to be here, Ms. Mount. Thank you for letting us do this. With our reintegration plan, we're doing it with 4 different elements. One is going to be policy, one is going to be prevention and response, communication, and documentation. Inside our policy is going to be what we're trying to accomplish with the reintegration. And when we're saying the reintegration, a lot of us, we're trying to figure out ways we can bring the public in, keep the public safe, and the employees safe and healthy also. With prevention, we're going to figure out ways to screen employees. I think that's one of the big things that everybody kind of said in the survey, and we're going to go over one of the observation stuff that we did here a little bit later on. We're going to work on how to handle sick employees with isolating them in certain rooms. I know one thing we always talk about, how do we take temperatures? And one thing we're just trying to stress are the HIPAA laws. Make sure we're doing those in accordance. One thing that I truly learned throughout this whole process is the difference between sanitation and disinfecting. I always thought it was the same thing, but I have truly learned sanitation is cleaning, disinfecting is where we're actually killing viruses. PPEs. There's one thing we're working with Mr. Campbell, David Campbell, making sure that all buildings have all the PPE needs. Barriers, masks, shields, hand sanitizer, anything they need. Another one, just basically learning about COVID exposure. That's the one thing that everybody, I know Mr. Kurt Gill and I, we've talked about it before. Ms. Stafford, he and I have been dealing with this product about 3 months now. It's ever changing. And so we're going to keep adapting with the whole process. Communication is going to be our third one. With the communication, it's going to be the chain of notification. Notify your immediate supervisor, department head, and then Ms. Mallett. Huge one, signage. On Thursday and Friday last week, and we did some today, we kind of went on what we're calling covert missions. And we went around to all the departments. Some knew, some didn't, and it was kind of cool. And when we walked in, it was kind of like the principal showed up. And we just wanted to see how they are working. Are they using masks? Are they using the barriers? Is there a place for hand sanitizer? Do we have an appropriate entrance and exit plan? So we got some survey notes. We're going to put those together. Hopefully we should have those to you guys here in about a week. The last one is documentation. Inside that documentation is where we're going to learn everything from the CDC, what they have to offer, the forever changing ways. I know in the last week and a half it went from 14 to 10. So this thing is ever changing. We're going to keep evolving with it. Any questions?
As you can see, they're very fired up on this task, and we're so grateful to have them. Ms. Stafford, you didn't hear from unless you want to speak next. But he is also a member of the task force. He said they said it all. But we really appreciate the efforts that the task force is putting into this effort. There's a ton to do, and we are continuing to learn more and more as guidance changes. I also thought Mr. Welch may want to add something. Not sure.
I just want to thank them as well, and it's not easy. I mean, a lot of the departments are finding it difficult to provide services like they normally do, and we ran into this last week as we tried to start up services again, and just the COVID just keeps coming back, and we have to close things down. And so we'd ask that you be patient with us. We're trying to use the staff we have. We're all learning. All of us are learning something we never expected to be doing this year, and so we're having to provide services in a different way, and it's just not like it used to be. And so we're adapting the best we can right now to continue to provide those services. And some of that's we're having to cancel something. Some of it's people are calling in, teleworking, and so it's all over the board. I wish we had a single solution for every department and every situation, but as Ms. Mallett was mentioning earlier, we just have so many different situations with employees, their families, the workplaces where they're at, that it's kind of a challenge. And so we're all kind of working through that together, and it's nice to have the task force to have a fresh look at what we're doing, just to make sure we're consistent throughout the county. So we look forward to their progress and what they'll be doing and the recommendations they'll have.
I have a request, and we cannot let two recreators speak and not the third one. So, I'm not gonna ask a question, but if it's okay, Mitch, I'd like for you to go to the mic.
Okay.
Tell us how your life at the recreation department in a couple, 2 or 3 minutes has changed since the moment.
Mr. Roy, thank you for bringing me up here. Appreciate that.
You're certainly welcome.
As I mentioned before, this is an ongoing, living, breathing thing. So, we're making modifications as we go along, and we'll continue to do that as we go along as well. We are excited about this reintegration program. I'm glad we could help. I'm glad we're involved in it. I know each one in our department is dedicated to serving Bullitt County.
Any questions of Mitch or any of the others?
I just like to thank this group for stepping up to the task force. You kind of had to step out of your comfort zone from recreation, and just thankful that y'all are willing to do this for all the citizens of Bullitt County, but also, our staff as well. And I just want to commend y'all and thank y'all again.
Thank you. Thank you.
You're welcome, Mitch. Thank you all for coming and sharing with us tonight. And I know it's quite a change at Recreation Department with the kids not there, and hopefully it'll all get squared away before long. And let's see. I'm gonna ask now, is there any public comments from anyone? If so, I'm gonna ask the recreation staff to stay just a minute. Are there any comments? Yes, sir. If you'll step up and state your name, address, and you've got 4 minutes.
Okay, good evening. My name is Brian Powell, 607 Colfax Station Drive, and I would just like to ask the board to give us an update on the paving process for Miller Street extension.
Yes, sir.
Yes, I'll do it from here.
And sir, if you'll state your name and title, I would appreciate it.
Brad Deal, County Engineer. As you all know, we approved the contract with Ellis Wood Contracting to do the paving on Miller Street Extension and Colfax Station. We issued a notice to proceed, I think about 2 weeks ago. And right at this point, we're just waiting on the contractor to get started. From what I can tell, they are trying to finish up some other projects before they move over to it. We're bothering them, harassing them a good bit to try to get them started, but they just haven't got started yet. But the deadline on the contract is December 31st of this year, so they have to have everything complete by then, or we have some liquidated damages in the contract. So that's the current status at this point.
Okay, has the contract been signed?
Yes, it has.
Okay, when was it signed?
I don't know the exact date that it was signed, but I know we issued the notice to proceed with them, which is kind of their official, you gotta get started, the clock is ticking. That was done probably somewhere around 2 weeks ago.
Okay, all right. And if they do not finish December 31st, what happens?
We have some liquidated damages in the contract, so basically they're gonna lose some money based on how many days over that deadline that they go.
Okay, is that public?
I'm sorry, what was
The
that?
liquidated damages, the percentage amount, is that public knowledge?
Yeah, it would be. I don't have it with me. I didn't bring that contract, and I don't remember off the top of my head what the number is, but I can definitely look that up and let you know.
Okay, fantastic. My only concern, how much time do I have left?
Oh, minute and a half.
Okay, my only concern here is that if that does not occur, going into the winter, the way the county left the state of the condition of the road, that neighborhood, which I happen to live in, and 5 other elderly families do as well, it made it this past winter to where if there was a fire or if there was a heart attack with one of the elderly, ambulance or a fire truck would not have been able to gain access to that neighborhood. And there's a grave concern about winter's coming. And so that's the biggest deal. And so, you know, if we can rock up to the neighborhood, that would be fantastic. Not asking for asphalt this winter, just some rocks.
All right, well, the plan is to finish everything by December 31st. I know winter would technically start a little bit before then, but the plan is to finish the whole thing by the end of this year. So.
Okay, fantastic. Thank you. I got a few seconds to spare.
Yes, sir. You still got 14. Thank you for coming.
Yes, sir.
But I'll assure you that if it gets real bad, if we have the public works director here tonight also, we probably could do a little scraping or something, make it safe. But hopefully they'll get started on it tomorrow.
Thank you very much.
Yes, sir. Thank you for coming. Anyone else with public comment? Okay, I'm gonna take the time to do something now, is to, I wanna call Eddie Cannon up. And the reason I wanted the staff to stay here, they've already probably heard him introduce himself 3 or 4 times, but I want him to do that tonight. This is Eddie Cannon, new recreation director, and y'all don't know how fortunate we are to have him. He's probably worked 100 years in recreation, then retired, decided he wasn't through with recreation and wanted to come back. So rather than me doing it, if you would just tell us a little bit about yourself, Eddie, and where you've been and what you think about Bullock County.
Sure. Thank you, Chairman. It is indeed a pleasure for me to be here and be a part of this great community. As you can tell tonight, what a great staff we have, and it's just an honor to be able to work with them to take the department into the future. I'm excited, really excited about that. I've worked in North Georgia for the last 40 years. I started with the city of Roswell, went to the city of Cumming, and then finished my career in Cobb County. I was in Cobb County for 22 plus years. Really great experience there. But it was time for me to, I thought, retire. And I retired in January, and I couldn't stand it. It wasn't in my blood to be retired, so great opportunity came available. And I appreciate y'all trusting me to be able to come down here and be the director of the Parks and Recreation Department. I love what I do. I love Parks and Recreation. I love working with the community and being a part of the community, and working with staff. We're going to go great places. I know that already. Been here a week and a half, and it's amazing what the ability of the staff and the ability that we'll have to move things forward. So excited to be here. I'm out there. Please call on me at any time you need anything. Be more than happy to talk. Be more than happy to do whatever you need me to do. Just let me know. But again, excited to be in Statesboro. I did have a son that went to Georgia Southern. He's been out about 5 years, so we got to spend 4 years in the community and really enjoyed it then, and excited to be back. So thank you, Jim.
Yes, sir. We certainly thank you. You know, this weekend I went out to the Ag Arena to watch some roping, and the first person I saw sitting there was Eddie. So he is involved, and he's going to do us a super job. He's a super hire. And does anyone have any questions for him? We
We're
certainly-
glad you're here, and we look forward to working with you.
Thank you, thank you.
Yes, sir.
Thanks, Jim.
Now, Kimberly, leave now. Next will be our consent agenda. We have 8 items on it. It's approval of the July 21st minutes, Stilson Park Playground Equipment, Parks and Rec, a roll-off truck purchase, Public Works, fiscal year 2021 laptop bid, administration, Coastal Regional Advisory Council appointment, Mr. Alan Amerson, MOU between the Board of Commissioners and the Bullock County Board of Health, payroll deduction agreements for AirMed Care, which is AirVac, Human Resources, the Coronavirus Relief Fund grant agreement with the administration. Now, we can vote on these collectively or pull out any one to put under new business and discuss it, vote on it separately if you like, just whatever your choice is.
Chairman, these all look routine to me. I would just move we approve the consent agenda unless somebody wants to pull one off.
Okay, we have a motion to approve.
Second.
We have a motion to second, any more discussion? All those in favor of approving collectively, consent agenda is now approved. Going to new business, we're gonna have a road resurfacing for fiscal year 21 and tell you the roads that are going to be resurfaced coming up.
Thanks, sir. Brad Hill, County Engineer again. This project includes approximately 16 miles of resurfacing on county roads. And the list includes Neville's Groveland Road in its entirety from Bryan County line to State Route 46. And that road is probably one that we've gotten the most complaints on the last couple of years. It's about 9 miles long, so that takes up a good bit of the resurfacing budget. Also, we have North Jackson Road, which is off of Highway 80 East in Grove Lakes. It's an old road that hasn't ever been resurfaced and has a lot of potholes that have been patched over the years since it's very rough. Next is East Drive, which is also in Grove Lakes. Mallard Pond Road from Lakeview to Middle Ground Road. And Old Bowling Store Road, which we've done a lot of patching on Old Bowling Store Road the last few years. And in this project, we're going to overlay the road so we can hopefully stop chasing all the potholes out there. We also had 3 add alternates, which were Brandon Road, which runs behind Splash in the Borough in Mill Creek Park, and J.C. Kennedy Road, which is off of Highway 301 South near Gateway Boulevard, and Sunset Boulevard, which is a street that is one of the entrance roads into Iron Gate. We received the sealed bids on July 21st, and the low bid was from Reeves Construction Company, and they met all of the county's bid specifications. The low bid came in well below our estimate, and I think it was due to the size of the project. It was a pretty large resurfacing project. The prices on the asphalt were a lot lower than what I expected, so we should be able to include all 3 of the add alternates that I just read. So the total price for all of that work would come out to be $1,877,800, and our estimate for that work was about $2.4 million. So you can see it came in well below our estimate. The project would be funded out of our LMIG funds and our T-SPLOST funds. We had about $1.6 million in LMIG funds and $1 million in T-SPLOST funds. So we had about $2.6 million in resurfacing, and about a little over 300,000 of that is going towards a road repairs project that we had previously put out to bid and got approved. So that's going to leave us with an excess of roughly $300,000 or $400,000 since we came in under budget. And some of the commissioners have mentioned a few roads where we have some issues. I know Commissioner Simmons has talked to me about a road, and Commissioner Rushing has, and Public Works has brought up a few hot spots. So I'm gonna be putting together a change order where we can do some additional work, I think with some of the leftover money that we have as well. So in summary, I'm recommending to award this contract, to Reeves Construction in the amount of, $1,877,800. And just for Jeff's benefit, Reeves was the low bidder in terms of the base bid, and then when you added all the three add alternates in, they were still the lowest. Now, there was some of the individual add alternates where there was another, bidder that might have been a little lower on one of the individual add alternates, but when you put it all into one contract, Reeves was the lowest. So, and if you have any questions, just let me know.
Okay, we have any discussion or questions? Go for the request.
Mr. Chairman, I move that we, approve the bid with Reeves Construction and move forward.
Second.
We have a motion and a second. Any more discussion? All those in favor show of hands. Motion's approved unanimously. Thanks, Brad. Moving along, we've got about probably 6 more minutes the way I figure. Staff for commissioner comments.
I'd like to just thank the liberation party and HR person, so I call it the C-19 problem. Thank you for what you're doing, and all staff, very good staff. I always say when I'm off in other counties, we got the best staff in the world, so don't knock them.
Anyone else?
If I can just mention one thing, well, I'm not sure if Tom sent this to you before he left on vacation, but we will have some tax hearings for the digest, which will be coming up, and so we'll get you the dates and times on those. One will coincide with our next meeting in 2 weeks, but we'll have to have one after that meeting to finish up the digest, adopting the digest, so.
I would like to make just a couple of comments. First of all, one of the most important things that everyone has done tonight, for each one of us, not necessarily for me, but, you know, we preach wearing masks, and I appreciate y'all having your mask on. There are times that I'll ride out, you know, the city and the county has really been working hard to put hand masks out, but I'll ride out to Lowe's or somewhere where they're set up on a Saturday morning. They don't see me because I'm in my truck. I don't want them to see me, but I go out there to see just how many people will not accept a mask. And it's, you know, and it's unbelievable. But there again, I personally have taken the stance, if you want to wear one, wear one. If you don't, then I don't think we can force you to. There's a lot of people with medical needs that, and reasons for not wearing one, but there's a lot of people that's just adamant about not wearing one. You know, I saw on Facebook not long ago, and you know it's true because it's on Facebook, is somebody got shot in a Walmart because they tried to force them to wear a mask and would not do it. There's a lot of stuff going on right now. We were on a Zoom call with the president of Georgia Southern, and that with all the students coming back, they've done everything that they can possibly do until the students get here, then to see the reality of what's going to happen. Was on another Zoom call today with Dr. Gerges and several other people about instant, I guess, after you take a test, within 15 minutes, you'll know whether you have the virus or not. And and there's just a lot of stuff going on. I'm hoping that in a short period of time that we can all come, put all of our chairs back in here and have a meeting as normal. But until that time, we're gonna have to do everything that we can to try to defeat this virus somehow. And maybe a vaccine will come out before long. But that's all the comments that I have, to be safe out there. And if it's where you can, I know y'all will, wear your mask. You look around here, you can walk in the door, you can take your temperature, you can wash your hands, we've got it set up for 6 foot, self distancing, and, we can't stop you from touching you, we can't make you do anything, but, touching your face is something that's very important not to do. So, I mean, that's the 4 things that we've sort of been shared that would help us keep this virus or keep from catching it. So, having said all of that, I appreciate y'all coming, and I'm gonna ask, do we have a motion to adjourn the meeting? We have a second? All those in favor? Unanimous approval. We certainly appreciate y'all.